You know, it's been a great thing that they've noted since 1991 that there's been a decline in cancer-related deaths of 25% during that period of time. That actually translates to 2.1 million cancer survivors during that period of time, thanks to improvement. That improvement is believed to be related not only to the treatments, which have made dramatic advances, but overall we're doing much better in early detection and, in particular, prevention. Patients are being more aware of their care and different techniques that they can use to prevent cancers. As we look at this, we really have to look at different levels. Everything from treatment, especially of advanced cancers, and in my practice, I primarily focus would be on breast cancer reconstruction in particular, and treatment of melanoma. Melanoma has made amazing leaps and bounds as far as treatment options, from immunotherapy to viruses that are actually directed towards the cancer cells have really changed the lives and the outcome dramatically of melanoma in particular and many other cancers. But as we look at this also, you almost have to go a step closer, which is what's done very locally with local physicians, local facilities, which is treatment of everyday cancer, earlier stages, and more important than even the treatment, and what this study is recognizing, is early detection. Early detection is completed right at home. It's with your primary care physician, gastroenterologist with colonoscopies. And even one step before that is what patients do at home, the preventative measures. We've seen a substantial decrease in smoking, working towards improvement in obesity, sunscreen, among other things, in order to help. We'd like to stop cancer after it's developed, but more importantly, we want to stop it before it occurs. We're finding these screening tools have made a substantial improvement. Everything from mammograms when appropriate, regular examinations. We're looking at low-dose CT scans for early detection of lung cancer, and it's regular Pap smears, and it's hard to beat colonoscopies. Colonoscopies have been found not only for early detection of cancer, but some of these early polyps that could go on to become cancer are treated. So not only is it early detection, it's actually early treatment, which can dramatically affect the outcome of that type of cancer. There's been a long-standing disparity between outcomes and cancer death rates with different ethnic groups, and fortunately we're making progress. This is improving for all groups, which is a wonderful thing, but there's a lot more we can do for this, and I think better access to care, more resources, and as time goes on, I think as we can provide better coverage and better access, I think we're going to see these differences in cancer rates and death rates related to it continue to improve. I think the future, in my experience, is more in melanomas, but really some very good outcomes for cancer treatment have been these either immunotherapies or directed viruses, which you can actually put basically an antigen receptor for that, which is part of the virus, which is part of the cancer, into the virus. You can make the virus then attack only those cancer cells and kill them. And there's been great progress on that. Spectrum of cancers, there can be different treatment options. So in the past, what we've done with different types of cancers is we've actually just targeted that cancer. But what we're realizing now is particular cancers have particular factors that are unique to that exact cancer, and maybe we can become more specific and target your cancer, not the population's cancer, but your exact cancer, your exact problem, and try to cure it with a better success and less side effects.